Hello guys, welcome back to another video. So today we discuss about how we diagnose acid reflux. And the diagnosis of GERD is usually made of typical symptoms are present. Reflux can present in people without symptoms. And diagnosis require both symptoms or complication and reflex of stomach contact. Other investigations may include EGD. Barium swallow X-ray should not use for diagnosis. Esophageal manometry is not recommended for use to the diagnose, being recommended only prior to surgery. Ambulatory esophageal pH monitoring may be useful in those who do not improve after PPLS, and is not needed in those in warm bariatric esophageal rinsing. Investigation of H. pylori is not usually needed. The current gold standard for diagnosis of GERD is esophageal. pH monitoring is the most objective test to diagnose. To reflux disease is allowing monitoring GERD. Patient in their response to medical or structured entertainment treatment. One practice of diagnosed GERD is short-term treatment with proton pump inhibitor. With improvement, symptoms suggest a positive diagnosis. Short-term treatment with the protein pump inhibitor may help predict abdominal 24-hour pH monitoring. Result among patients with symptoms suggestive. Endoscopy is the examination of symptoms with a fiber optic scope. Is no routine needed for case in typical a response to treatment. It is recommended when people either do not respond well to treatment, have an alarm symptom, include diaphragm anemia, blood in stool, wheezing, weight loss, or voice change. Some physicians advocate either once in lifetime or 5 to 10 yearly endoscopy. For people long standard to evaluate the possible presence of diastole and braided esophagus biopsy performed during a gastromeso. Edema and basal hyperplasia, non-specific and inflammatory changes, lymphatic inflammation, non-specific, neurofocal inflammation usually due to reflex, endothelial inflammation usually due to reflex. The presence of interfetal esophagus may suggest a diagnosis of esophageal EEC. If esophagus are present in high enough number, less than 20 oesophagus per high power microscope field, a distal esophagus in gobadal cell initial metaplace a better esophagus. Elongation of papillae thinking for squamous cell layer. Diaphlase, reflex changes that are not erosion in nature lead to the non-free reflex disease. Severity may documented with the Johnson scoring system. Different diagnose other cause of chest pain such as heart disease should be ruled out before making disease diagnosis. Another kind of acid reflux which causes respiratory and laryngeal signs and symptoms is called laryngeal reflux (LPR), an esophageal reflux disease. Unlike GERD, LPR rarely produces heartburn, and its symptoms cause silent reflux. Differential diagnosis of GERD can also include dyspepsia, hepatic ulica disease, esophageal and gastric cancer, or food allergies. There are major symptoms such as edaphy and basical hypersis, lymphopenia inflammation, neurophilic inflammation, eosinophil inflammation, elongation of fiber, thinning of cell layer, death cell and chromia. The endoscope of the examination of the stomach with the fiber optic scope when the other people do not respond. Well to treatment and high virus symptoms, including disease and many other 10-year endoscope for people long-standing blood to evaluate the possible presence of phase and Brady esophagus. Notify and basal are the inflammatory changes. Lymphatic inflammation, ureteric inflammation usually do.